Hey everyone, hope you're having a good day. My name is Jocelyn Townsend and I'm the host of the Yoga Room, and this is my dog Phoebe. Today we're going to be talking about carpal tunnel syndrome and cubital tunnel syndrome. So if you're watching this, I imagine that you or somebody that you know have either of these symptoms. Just for your own benefit, you might feel relieved knowing that it's one of the most common upper arm diseases or disorders, tensions, that people experience in the Western world. Before you look towards surgery to deal with it, a lot of people find relief in exercises such as physiotherapy and yoga. Because I'm a yoga therapist, we're going to look at some of the yoga stretches that we can do to help this syndrome and how knowledge of the anatomy and working with the body can reduce symptomatic pain and for some people even create long-term relief. Carpal tunnel syndrome affects approximately 5% of women in the Western world and 3% of men. It is triggered when the median nerve is compressed. The median nerve runs through the carpal tunnel, which is intersected at the base of the palm by the flexor retinaculum. In the wrist, there are 8 bones known as the carpal bones, 4 of which are pertinent players in the formation of carpal tunnel syndrome. They are the pisiform scaphoid, hamate, and trapezium. These bones work with the flexor retinaculum to hold in place the tendons that lie beneath them. The median nerve is well embedded within the tendons and lies inferiorly to the flexor retinaculum. It then branches out to the thumb and the 2.5 first fingers. When there is chronic tension in the flexor retinaculum, it compresses the tendons below it in towards the median nerve. This is the cause of carpal tunnel syndrome. The secondary cause would be swelling and/or inflammation of the tendons, causing compression of the median nerve. Edema, pregnancy, misuse of the wrist, and pressure on the forearms are all examples of things that cause inflammation in the tendons of the wrist. So one of the most important factors for healing carpal tunnel syndrome or cubital tunnel syndrome is examining how you sit at your workspace. So a lot of people end up doing things habitually that are detrimental towards the body. So if we're having a long work day, we might hunch our spines over, we might lean on our desk, we might cross our ankles or scooch our feet up on the edge of a seat. And essentially what this does, as we talked about before, it puts a lot of pressure on the forearms. For cubital syndrome, it puts a lot of pressure on the wrist, which affects the ulnar nerve and shoots up towards the hand. So when you're making these adjustments, and you're making these adjustments to your lifestyle, one of the most pertinent things you want to think about is creating a solid base. So when we sit at our workstation, we want to make sure that the heels stay underneath the knees, and the legs are at about a 90-degree angle from the ground. So adjust your seat if that's necessary. And then you can see once we have this stable base, we have the ability to support the spine. So you want to be close enough to the workstation that when your spine is erect, your ribs are drawn back and the top of the sacrum is pulled in, you can keep the shoulders and the elbow to about a 90-degree angle. Once you have that 90-degree angle in the arms, the wrist should be slightly above the keyboard. This way you're not compressing down into the wrist when you type. It's the compression of the flexor retinaculum that eventually leads to carpal tunnel syndrome, and it's on the elbow that affects the ulnar nerve that creates cubital tunnel syndrome. So it's a good idea to look at what your habits are here and try to implement this idea of an erect spine and 90-degree angles to take pressure off of the wrists and the forearms. So when we start doing our stretches, the first thing to keep in mind is that you're probably in a lot of pain and you'll want to start stretching by addressing the pain. On a regular basis, you should be doing things to stretch out the wrist, and then you should look at the body as a whole to see how the alignment of the body is affecting the posture of the shoulders, the neck, and the arms. So to start by stretching the fingers, a really good stretch that you can start with is just lengthening the fingers down and away from the palm. Depending on the severity of your syndrome, it's gonna be fairly intense. And so just go to the point where you feel there's a slight amount of tension, but you're not at the point of shooting pain. The next stretch that you can do is specifically for carpal tunnel syndrome. You'll need a strap. If you don't have a strap, you can try with a belt or a cuff. So take your strap and you want to make a small loop in it and place the strap at the base of the thumbs. Placing the strap at the base of the thumb, spread the fingers wide and pull the thumbs apart. You should feel a stretch within the flesh of the thumb, particularly between the index finger and the thumb, and you should feel it move down towards the wrist. Following that stretch, we can start moving towards the wrists. You can bring the hands into prayer position. And then pressing the base of the palms together, spread the fingertips apart. Pull the shoulder blades down the back and drop the shoulders down. If your wrists are feeling up for it, you can do another stretch that's very similar to the prayer position, but with a little bit more pressure. You just want to place the fingertips on the ground in front of you, and then bringing the fingertips down, start to bring the wrists towards the ground. And slowly and mindfully bring the wrist back up to come out of pose. The next thing we want to look at when we're stretching is the alignment of the shoulders, particularly in the case of cubital tunnel syndrome. The shoulders are often hunched forward and there's compression of the ulnar nerves at the head of the shoulder blade or sometimes even at the elbow. The next pose that we're going to do is going to require the corner of the room or a door frame. So just walking over towards a corner, bend the elbow to 90 degrees. Place the forearm in the nook or the corner of the room, and then slowly start to walk the body away from the upper arm. If you're doing the stretch properly, you should feel this primarily in the head of the shoulder and the pec. Safely coming out of the pose, turn the torso into alignment with the arm and the head of the shoulder. Lower the arm down. And do the second side. So, after we've done the shoulders, the next thing we want to do is the neck. So depending on the tension that you feel in your neck, there are different severities of stretches that we can do. We'll start with the lighter one and then we'll move to more the deeper stretch. So the first stretch you want to think about doing is just very, very slowly dropping your ear towards your shoulder. If you can keep the shoulder blades down the back as you do this, you're going to feel a greater dynamic in the stretch. Inhale, coming back up. And then do the second side. If this isn't an intense stretch, you can add to the stretch by placing your hand on the opposite side of your head, placing the arm down, and gently gliding the head to the side. And when you're finished with your stretching, the next most important thing you can do is Shavasana. So we're going to look at a variation of Shavasana, which is sometimes called heart bed. And for heart bed, you're going to need 2 blocks. So grabbing your 2 blocks, place one block lengthwise and the other block widthwise on the second height or the third height to support the head. The shoulder blades are going to fall to either side of this block here, and the head is going to rest on the second block. What this is going to do, it's essentially going to deepen the pectoral and shoulder stretch we did at the wall, except it's going to allow this to happen in a restorative posture. Depending on the flexibility and the tension in the shoulders, you might want a second pair of blocks. You can also use books or a bolster, anything to support the lower arm. And place them down. Turn around, flex the feet. Inhale, lift up through the heart. Guide yourself back mindfully, so you might need to adjust the blocks. That's okay. And then once you have the blocks in a position that's comfortable for you, you can bring the arms out to the side of the body, cactus pose or lengthening the arms out. And you just get to relax here. Come out of the posture, plant the hands next to the hips. Bring the chin towards the chest. Lift the chest up. Cross the legs. I hope that was helpful. And have a really lovely week.